Hey everyone, welcome to HomeoEd. Welcome to your crash course on two subjects that might seem a little intimidating at first. Organon of medicine and psychology. I know what you're thinking. With all the anatomy, physiology, biochemistry, you have to cram. Why add these to the mix? Trust me, understanding these subjects is like having a secret weapon in your medical toolkit. They are not just about passing another exam. They change how you see your patients and how you practice medicine. These subjects are the bridge between the science of a disease and the person who has it. They will set you apart as a compassionate, effective doctor. Think of it this way. Your hardcore science classes teach the what of medicine, what disease is present, what medication to prescribe, what procedure to perform. Organon and psychology teach the how and the why. How do you understand the patient's unique experience of illness? Why aren't they following your advice, even when it's for their own good? First up, let's talk about the organon of medicine. The name itself sounds pretty old school, and honestly, it is. The word organon means a tool or instrument for acquiring knowledge, and that's exactly what this book is. Written by Samuel Hahnemann in the early 19th century, it's a foundational text for homeopathic medicine. Regardless of your views on homeopathy, the organon's principles influence the philosophy of medicine, especially treating the patient as a whole person rather than just symptoms. So why is this 200-year-old book on your syllabus in 2025? Because it argued against harsh practices of its time, like bloodletting and purging. Hahnemann pushed for a gentler, individualized approach. He emphasized detailed case-taking, understanding the patient's lifestyle, and considering their mental and emotional state. These ideas were revolutionary and underpin holistic, patient-centered care. Studying the organon gives you historical perspective. It explains why we look beyond lab results to see the complete picture. Think of it as a philosophical guide. It challenges you to think critically about disease and healing. Hahnemann said symptoms are not the disease itself, but the body's outward expression of an internal imbalance. That pushes you to investigate root causes, not just suppress surface complaints. For a medical student, this is a powerful lesson. It trains you to be a detective, piecing together clues from a patient's life. It's the difference between giving cough syrup and asking what in the patient's environment or lifestyle might be causing the persistent cough. Ultimately, the organon isn't about converting you to one therapy. It's about a philosophy of care. It teaches you to be a keen observer, a patient listener, a compassionate investigator. It reminds you the person is more than a diagnosis. They have a story, a context, and a unique way of experiencing health challenges. Grasping that is not just essential for exams. It's a cornerstone for a meaningful medical career. Let's break down the organon into its core components. Starting with its origins and the man behind it, Dr. Samuel Hahnemann. Hahnemann was a physician who grew deeply disillusioned with the medical practices of his era. So he quit his practice and began translating medical texts. It was during this time he found a description of cinchona bark, the source of quinine, used for malaria. He decided to experiment on himself. He took doses of the bark and observed it produced symptoms similar to malaria in a healthy person. This was his aha moment. This self-experiment led to the first major principle of homeopathy, similia similibus currentur, which translates to, let likes be cured by likes. The idea, a substance that causes symptoms in a healthy person can, in very small doses, treat similar symptoms in a sick person. This principle is a central theme throughout the organon. For your exams, understand this concept not just as a definition, but as the philosophical basis for a different approach to pharmacology. It's about matching the symptom picture of the medicine to the symptom picture of the patient, which requires an incredibly detailed understanding of both. Hahnemann's contributions didn't stop there. He was a pioneer of the scientific method in medicine, advocating provings. Provings were systematic experiments giving substances to healthy volunteers. They recorded every physical, every mental, and every emotional symptom produced. This work produced the Materia Medica, a vast encyclopedia of medicines. The emphasis on rigorous observation and detailed documentation is a lesson for every medical student. Another key contribution is the concept of the vital force, or Lebenskraft. For your studies, think of it as a metaphor for the body's innate intelligence and healing capacity. Modern medicine talks about homeostasis and psychoneuroimmunology. The physician's role is to support and stimulate that capacity, not to override it. Keep these ideas in mind as we look at the organon's structure next. The organon of medicine is structured in a unique way. It's written as a series of numbered paragraphs called aphorisms. There are 291 of them in the 6th edition. Each one builds on the last, laying out Hahnemann's medical philosophy step by step. For exams, you won't need to memorize all 291, but you must know the first few. They set the stage. Aphorism 1 is the most famous. The physician's high and only mission is to restore the sick to health, to cure. This simple statement is profound. It defines the doctor's purpose, not just managing disease, but restoring complete well-being. Aphorism 2. The highest ideal of a cure is a rapid, gentle, and permanent restoration of the health. This contrasts with the harsh treatments of Hahnemann's time. Ask, are treatments gentle or harmful? Do they give permanent solutions or temporary relief? Seek elegant, least invasive solutions. This echoes modern medicine. Individualization is key. Aphorism 6. Look at the totality of symptoms. Disease is a unique event in an individual. Two people with asthma can be very different. Case A, wheezing worse at night with anxiety. Case B, worse in the morning with a dry cough. These are different cases needing different approaches. Be an excellent listener and observer. This is personalized medicine. Practical tip. Make a mind map. Put organon in the center. Branch to Hahnemann, similia, vital force, individualization. Under each add key aphorism numbers and a one-sentence summary. Practice by applying to patients you've seen. Describe their totality of symptoms. Active application cements knowledge better than passive reading. Active application cements knowledge better than passive reading. We've covered the organon basics. Now let's shift from 19th century philosophy to the modern science of the mind. Psychology. In the simplest terms, psychology is the scientific study of the mind and behavior. All right, let's shift from the 19th century philosophy of organon to the modern science of the mind. Psychology. In the simplest terms, psychology is the scientific study of the mind and behavior. It explores how we think, how we feel, how we act, and how we interact with the world around us. For a medical student, this isn't just an abstract academic subject. It's one of the most practical tools you will ever acquire. Every single patient you meet will have a unique psychology that influences how they experience their illness, how they communicate their symptoms, and whether or not they follow your advice. Ignoring psychology in medicine is like trying to navigate a city with a map that only shows the buildings but not the streets that connect them. The role of psychology in medicine is immense, and it touches every specialty. It's the foundation of psychiatry, but its importance doesn't stop there. Understanding a patient's anxiety before an operation can lead to smoother recoveries. Consider a family physician helping a patient manage diabetes. The patient's motivation, beliefs about their illness, and stress levels will have huge impact on blood sugar control. Psychology helps you understand these invisible forces that shape a patient's health. One of the most critical areas where psychology applies is the doctor-patient relationship. This relationship is a powerful therapeutic tool in itself. A patient who feels that their doctor understands, listens, and respects them is more likely to trust their doctor's judgment. This trust, known as rapport, is built on psychological principles of empathy, active listening, and effective communication. Learning psychology teaches you how to build that rapport. It helps you read nonverbal cues, ask open-ended questions, and validate a patient's feelings, even if you don't fully agree. These soft skills are actually hard science, and they are essential for effective medical practice. So as you study psychology, don't just memorize definitions of terms. Think about how they apply to the human interactions you see every day in the hospital or clinic. Understanding the why behind behavior can change your approach and turn a difficult encounter into a productive and compassionate one. Now let's get into the nitty-gritty of the psychology syllabus. You'll encounter a lot of topics, but let's focus on a few high-yield concepts that are incredibly relevant for a future doctor. First up is the classic debate, nature versus nurture. This is the question of whether our behaviors and personalities are determined by our genetics, nature, or by our environment and experiences, nurture. In medicine, you'll see this play out constantly. A patient might have a genetic predisposition for heart disease, but their diet, exercise habits, and stress levels will play a huge role in whether they actually develop the disease. Understanding this interplay is crucial for both prevention and treatment. Next, you'll study different schools of thought in psychology: behaviorism, cognitivism, psychodynamics. Don't get bogged down in historical details. Instead, focus on the core idea of each and a medical example. Behaviorism, championed by figures like B.F. Skinner, suggests that our actions are shaped by rewards and punishments. This is super relevant when you're trying to help a patient change a habit, like quitting smoking. Providing positive reinforcement, praise and encouragement can be more effective than focusing on negative consequences. Cognitive psychology focuses on our thought processes, beliefs, assumptions, and interpretations. This is the basis for cognitive behavioral therapy, or CBT. CBT helps patients identify and change negative thought patterns, practical and powerful for anxiety and depression. Psychodynamic theory emphasizes the influence of the unconscious and early childhood experiences on current behavior. A patient who had a traumatic experience with a doctor as a child might exhibit extreme anxiety or mistrust in a medical setting as an adult. Being aware of this allows you to be more patient and empathetic. To keep these schools straight, create a simple chart: school, key idea, and a medical example. Example: using a reward chart for a child taking medicine, helping a patient reframe negative thoughts about their diagnosis. This active learning technique will help you compare and contrast theories and, more importantly, see their practical value in a clinical context. These theories are different lenses through which you can view and understand the complex human being who is your patient. Two of the most important psychology topics for any medical professional are perception and motivation. Let's start with perception. Perception is how we organize and interpret sensory information. The key takeaway: perception is subjective. Two people can look at the same thing or experience the same symptom and perceive it completely differently. For a doctor, this matters. Your patient's perception of pain is their reality. Don't dismiss pain that conflicts with your findings. Subjectivity is shaped by many factors: past experiences, cultural background, mood, and expectations. Example: someone who watched a family member suffer from cancer may see a minor symptom as a sign of impending doom, causing major anxiety. Your role is to understand their perceptual filter, not just say they're wrong. Ask, what are you most worried this could be? That acknowledges fear and opens the door for reassurance and accurate information. Now, motivation. Motivation is the driving force behind actions. In medicine, you'll motivate patients to make healthy changes. Key model: extrinsic versus intrinsic motivation. Extrinsic, outside reasons. Intrinsic, internal reasons. Intrinsic motivation is more powerful and sustainable. Help patients find internal reasons for change. Use motivational interviewing rather than admonishing. Don't just say, you need to quit smoking. Ask, what do you dislike about smoking? And what benefits would quitting bring you? Remember ORS: open-ended questions, affirmations, reflective listening, summaries. Using ORS can transform behavior change conversations and make patients active partners in care. Perception and motivation are tools you use every day to understand the patient's world. Next, we'll look at learning, memory, and emotions, three psychological pillars fundamental to your daily practice. We've already touched on behaviorism, but let's consider classical conditioning, famously demonstrated by Pavlov and his dogs. In a medical context, a patient might develop white coat hypertension. Their blood pressure spikes only in the doctor's office. Next is memory, crucial for you as a student and critical for your patients. How much of a diagnosis and complex treatment plan do patients remember an hour later? Shockingly little. Use the teach-back method and provide simple written materials or visual aids. Can you tell me how you're going to take this medication? For a long time, medicine tried to be purely objective, pushing emotions to the side. We now know this is a massive mistake. Stress and anxiety can weaken the immune system, increase inflammation, and exacerbate conditions like IBS and eczema. As a doctor, be attuned to your patient's emotional state. Ask, how have you been feeling emotionally with all of this going on? Emotional intelligence is a skill you must cultivate. Recognize and understand your own emotions and the emotions of others. A patient might express anger, but the underlying emotion could be fear. Respond to the fear, not the anger. For example, saying, "This must be very frightening for you," can de-escalate and build trust. So we've journeyed through the organon and skimmed psychology. How do these combine to make you a better doctor? The answer? Holistic. Both push you to look beyond the biological and see the complete human being. A patient is not just a diseased lung or a failing kidney. They have a story, an inner world of thoughts and emotions. This holistic perspective trains you to be a meticulous observer and a patient listener. Value the unique details of a patient's story as much as lab results. The organon gives philosophical framing. Psychology gives practical, evidence-based tools. Active listening, motivational interviewing, ORs. It helps you understand why a patient might not take medication. Not because they're difficult, but because of beliefs, fears, or memory challenges. Combined, these skills let you navigate the doctor-patient relationship effectively and compassionately, improving outcomes. They also help you avoid burnout by finding more meaning in your work. So as you study for these exams, remember you're not just learning to pass a test. You're learning to be the kind of doctor everyone hopes to have. Brilliant and profoundly human. If you found this useful, like, subscribe, and leave questions below. I'll make follow-up videos on study tips and key aphorisms.